Kidney stones. You spend the last 5 hours scrubbing, washing, and cleaning your entire house. And now it's time for you to relax with some Netflix and chill. As you sat down with the popcorn by your side, you felt a dull pain in your back, but you dismissed it as a simple side effect from all the intense cleaning. However, a few minutes into the movie, the back pain instantly pumps from dull to severe. Kinda like when Elon Musk makes a tweet about Dogecoin. As you try to stretch your back, you feel the pain moving from your back to your side. Well, your Netflix and chill are definitely ruined because what is causing you all this pain is a kidney stone about the size of a grape moving through your urinary tract. These kidney stones are like those tiny pebbles you might kick around outside, but this time they're in your body and waging an all-out war against your urinary system. Imagine trying to push a jagged little rock through a straw, except the straw is inside you, and it's got nerve endings that scream with every slight movement. Kidney stones happen when the minerals and salts in your body turn into hard deposits and decide your kidneys look like a great place to set up camp. The only way to evict them is by undergoing surgery. The pain is usually so intense that people describe it as worse than childbirth. If pain had an Olympics, kidney stones would be top contenders, just neck and neck with burning and stabbing. Cluster headaches. Cluster headaches are like that one uninvited guest who shows up out of nowhere, eats everything in your fridge, and throws a wild party in your house. Except the party's in your head, and instead of having fun, it feels like someone's drilling a hot poker through your eye socket. The pain is brutal, sudden, and often concentrated around one eye, hence the name. It's like a mini jackhammer magically appeared in your skull, and it's hammering away with zero mercy. The headaches come in clusters because they tend to hit in groups, showing up around the same time every day or night for weeks or even months. It's like your body suddenly decides that 2 a.m. is the perfect time for a torture session, and there's nothing you can do but brace yourself. When the headaches show up, they don't knock or warm you up with a dull ache. They burst through the door just like how the Hulk smashes through walls. One minute you're fine, and the next you're clutching your head like it's about to split in half. No one knows why this happens. It's like the headaches are your brain's twisted idea of a fun time. But the good news is that cluster headaches don't last forever. They often come in cycles, and then eventually they disappear just as fast as they come. But there are treatments like oxygen therapy. That is, breathing into an oxygen mask or using medications for heart conditions to slow down the mind-melting agony. Third-degree burns. Third-degree burns are the ultimate bad news when it comes to burns. They're not your average, oops, touched a hot pan moment. Think of them as the final boss of burns. So basically, if first-degree burns are the annoying sunburns and second-degree burns are the blistery bad ones, third-degree burns are like your skin getting a hardcore, permanent reminder that fire is definitely not your friend. A third-degree burn would practically go through the outer layer and middle layer of your skin, fry right down to your muscle and bone, leaving your skin looking white or blackened like a burnt piece of toast that neither butter nor jam can save. However, what makes third-degree burns especially brutal, beyond the severe, unrelenting pain, is that they can actually destroy the nerves. So, unironically, you might not feel as much pain directly in the burned area because, well, those pain sensors have been roasted out of existence. The problem is that everything around it is in hyperdrive pain mode, and now your body is on a full-scale alarm. Think of it like your skin calling for backup, only the backup is just more pain. These burns are so serious that your body can't heal them on its own. Instead, they require skin grafts, where doctors take healthy skin from another part of your body and patch it over the burned area. It's like a little skin loan from one part of you to another, which sounds pretty cool, except for the fact that now 2 parts of your body need to heal. Tooth abscess. Imagine your tooth decides it's had enough of biting and chewing, then throws a tiny party at the root, inviting a whole bunch of bacteria to party down there. Only this party's not exactly fun. It's more of a pressure cooker filled with pain, and it's all happening inside your mouth. This is basically what having tooth abscess feels like. It all starts with a little cavity or crack in your tooth, which gives bacteria a VIP entrance straight to the most sensitive, nerve-filled core of your tooth. The bacteria would quickly set up camp, start multiplying, and pretty soon they're making pus, a delightful mixture of dead tissue, bacteria, and immune cells that's basically the tooth version of toxic sludge. Now, as this pus builds up, it causes pressure that feels like someone's jamming a needle into your tooth from the inside. The pain is next level and throbs in a way that demands full attention. It's like a fire alarm in your head that you can't shut off. Some people compare it to being hit by a tiny jackhammer, while others say it's like your tooth developed a heartbeat of its own. And that heartbeat is pure agony. Of course, you'd be unable to chew or drink, and even breathing cold air near the tooth would send fresh jolts of pain that'll make you rethink every sip of iced coffee that you've ever had. The good news is you can treat tooth abscess with antibiotics or extract the bad tooth, but if left unchecked, the infection could spread to your jaw, neck, or even your brain and turn into a full-blown mutiny with real health consequences. So ignoring it isn't an option unless you want to risk your whole face getting in on the drama. Road rash. Chances are you scraped your knee at least once, maybe from that time you tripped or fell from your bike. If yes, then you've already experienced road rash, and your brain probably still remembers how painful it felt. Road rash is basically that raw, stinging scrape your skin picks up when it meets the pavement a little too up close and personal. The scrape causes your skin to get peeled back layer by painful layer, revealing a red, raw mess that's somewhere between ouch and why did I ever go outside? All your nerve endings would literally be on high alert, making even the slightest breeze feel like a miniature torture session. The torture even worsens when cleaning road rash because as your skin scrapes the floor, it collects souvenirs along the way like dirt, gravel, and bacteria, which are all embedded in the wound like unwanted glitter from a terrible craft project. Now, getting those little bits out is like scrubbing your body with sandpaper. The pain is brutal, but if you don't clean it out, you risk infection, and honestly, you don't want to add a bacterial infection to the guest list of your healing process. And talking about healing, it is also an extremely itchy and painful process. Your body would try to repair itself with scabs, which makes the healing skin feel tighter than skinny jeans after a holiday feast. You can't bend, you can't stretch, and heaven forbid you laugh too hard if the rash is on your stomach or ribs. It's as if your skin's setting off tiny fire alarms every time you move. Torn Achilles tendon. First off, the Achilles tendon is that tough, thick cable connecting your calf muscles to your heel bone, a real MVP when it comes to movement. It's what lets you lift on your toes, jump, and basically move like you've got a little bounce in your boots. Now, to paint a picture of what a torn Achilles tendon feels like, imagine you're pulling a slingshot back as far as it'll go. The rubber's stretched to its absolute limit, but the rubber suddenly breaks and the recoil hits you with full force. That's the pain of a torn Achilles tendon, an instant gut punch sensation, like a rubber band snapping right at the back of your ankle, only 100 times worse. 1 second you're ready to jump or run, the next your leg's been hijacked and all you're left with is a brutal, unforgettable sting and zero ability to push off your foot. The sensation is like someone sneaked behind you and whacked the back of your ankle with a baseball bat. The pain is instant, sharp, and so memorable, it'll make you think twice about sprinting to catch that bus next time. You'd be unable to walk properly, and going downstairs would be like trying to perform the cha-cha on a tightrope. Fixing a torn Achilles tendon usually requires surgery, followed by months of crutches, a cast, and physical therapy. It's like going back to square one with your leg, where even flexing your foot feels like an Olympic achievement. Pancreatitis. If you've ever swallowed hot food that made you feel a burning sensation in your chest, then you already have a slight idea of what pancreatitis feels like. But to get the full idea, take that burning sensation, multiply it by 1,000, and push it all the way down your stomach. The pain is described as a deep, burning ache that radiates to your back like you've swallowed fire and decided to settle in for a long, painful stay. It's the kind of pain that makes you curl up like a shrimp and seriously wonder what you did to deserve this level of internal rebellion. The culprit of this painful rebellion is the enzymes released by your pancreas to break down food, but instead of quietly doing its job, the enzymes would go rogue and start attacking the pancreas itself. It's like a team of workers going on a very destructive strike in your own body. The result is a pain so sharp and persistent, it feels like you're being squeezed from the inside out by a very angry bear. And whatever you eat at this point just feels like you're literally throwing fuel onto that fiery protest inside your pancreas. What causes your enzymes to go rogue in the first place could be a result of eating excessive greasy food or heavy drinking. So if you've been partying a little too hard or feasting on a lot of greasy cheeseburgers lately, your pancreas might just decide to serve you a painful little wake-up call. Complex Regional Pain Syndrome, CRPS. Complex Regional Pain Syndrome, or CRPS, is like your body's drama queen response to an injury. Let's say you sprained your ankle or bruised your skin. Normally, your body would start healing the injury, and in a few days, you're all healed up. But if you have CRPS, instead of your body to get started on the healing process, your nervous system would essentially go into overdrive mode, causing that tiny injury to hurt like hell and take a long time to heal. It's like your nerves took that minor injury as a personal insult and are now determined to make everything hurt in the most extravagant way they can muster. CRPS is a rare neurological condition, and no one knows the exact reason why it blows what should be small pain out of proportion. And this condition doesn't just worsen pain and call it a day. Your skin would also be extremely sensitive that the lightest touch can feel like you just got sucker punched by Anthony Joshua. Even the softest blankets would feel like they're made out of sandpaper. It's as if your nerves are so on edge that they're auditioning for most sensitive nerve of the year, and every little touch is met with an all-out alarm. Your body would also experience temperatures differently. Whatever you feel is always cranked to the max, so if it's slightly cooler, your limbs might feel like it took a vacation to the North Pole, and if it's slightly warmer, it's like you're in the world's hottest sauna. Peptic ulcers. Picture your stomach as a nightclub, where stomach acid and food usually vibe together just fine. But one day, bacteria known as H. pylori sneaks in through the back door and crashes the party, leaving behind painful little sores that eat away at your stomach. This is basically how you get a peptic ulcer, and the pain is described as a special kind of fiery, gnawing ache that feels like your stomach is trying to digest itself, which in a way, it kind of is. You see, when you have a peptic ulcer, stomach acid starts irritating the open sore, so every meal turns into a showdown between your food and that sensitive spot. Talk about adding salt to injury. Literally, eating might relieve the pain for a bit, but after a few hours, the burn would come back. It's kinda like that one overly eager friend who keeps knocking on your door when all you want to do is lie down and escape. The pain never backs down. You'd sleep on it, that's if you're lucky to even get any sleep, and wake up on it. But with treatments to reduce stomach acid and antibiotics to kick the bacteria to the curb, you can become healthy again. Although, you need to say bye-bye to spicy foods, caffeine, and alcohol, as these just rile up the acid and make the ulcer burn even brighter. Instead, it's all about that bland, gentle food like bananas, oatmeal, lean meats, and pretty much anything that doesn't feel like it's hosting a rave in your gut. Gout. So you decided to take a permanent break from cheeseburgers and soda to start dining like a medieval king, focusing on rich foods like red meat and seafood and drinking wine. But one day, while you're just going about your day, an intense throbbing pain suddenly hit your big toe as if a 50-pound axe dropped on it. You look at the toe and see that it is swollen, red, and it's so tender that even the slightest touch feels like torture. Now, what is happening to your big toe is gout, an extremely painful condition that happens when your body builds too much uric acid, which then forms tiny, sharp crystals that love to lodge themselves in your big toe. Picture the crystals as a pile of microscopic needles that decide to host a surprise party in your toe joint, and you're the guest of honor, but instead of having fun, you're wincing at every step. It's like your foot has its own set of jagged, glittery decorations, and let's just say they're not the comfy kind. It's the kind of pain that'll make you reconsider your life choices, or at least that extra round of rich foods and drinks, which is one of the major causes of gout. You see, gout has been called the rich man disease because it's linked to foods high in purines, which are found in steak and wine. Your body breaks purines down into uric acid, and if you've got a little too much in your system, well, gout is your painful, toe-throbbing reminder. Other factors like genetics, obesity, and kidney issues can also play a role, making gout a bit of a sneaky contender that shows up when you least expect it. Dry socket. Dry socket is basically the ultimate dental betrayal, After going through the excruciating ordeal of a tooth extraction, likely the wisdom tooth, and just when you think you're on the road to recovery, bam! Dry socket crashes the party, bringing a world of pain you never saw coming. It's the sneaky sequel of tooth extraction that you never asked for but can never forget. It usually happens after a tooth is pulled. Now, a blood clot is supposed to form over the empty socket, like nature's little band-aid to protect the bone and nerves underneath while your gum tissue heals over it. But with dry socket, that precious blood clot is either lost or fails to form properly, leaving your bone and nerves completely exposed. It's like the clot took one look at the socket and said, "Actually, I'm out." Now imagine having a patch of raw bone and nerves exposed to everything that comes into your mouth. Every sip of water, every little breeze, and even breathing through your mouth feels like you're sticking a nerve in an ice bath while someone blows on it with an Arctic fan. You'd experience an unending thumping, deep ache radiating to your jaw, ear, and entire face. Basically, your mouth throws a fit, and there's nothing gentle about it. This pain is one of the worst dental pains out there. If you're unlucky and bacteria finds its way into the open wound, you'd be dealing with more than just pain. Your mouth would also smell so bad like it's hosting a tiny garbage dump. What triggers dry socket is sucking through a straw or smoking after an extraction. Basically, anything that creates suction in your mouth can dislodge the clot, which is why your dentist tells you to avoid all those things, even if it sounds a bit overcautious at the time. Turns out that advice is gold.